Hello and welcome back this week as we give an update on current public health issues in our 5-county district. Wanted to point out first of all that because of our measles outbreak, probably one of the largest in the United States right now as far as active cases, has garnered some attention. We've had some national media outfits from New York Times to NBC New York come down to little southwestern Utah to see what's going on here. I think the main questions they have is trying to get an idea of what our outbreak looks like, what are the demographics, the possible causes there, and so let me go over a few of those. As of this morning, we have 43 cases attributed to southwestern Utah, and that includes Washington, Iron, Beaver, Kane, and Garfield counties. Our cases so far have been restricted to Washington and Iron counties. That's where the majority of our population is, and we are part of a larger outbreak that includes northern Arizona, specifically Mojave County. I think they have over 50 cases at this point, and so we consider ourselves part of that outbreak that straddles the two states. We've had 5 hospitalizations related to this outbreak. All of those people have been discharged and have recovered at home. We have had a few infant cases, a few adult cases, but most of the cases are school-age children under 18, and all but one of our cases are unimmunized. That one other case has an immunization history. They're what we call a breakthrough case, where the vaccine didn't quite take or they didn't have the immune response they needed. Other than that, we don't know if we are related. It's likely, but we don't know the origin of our outbreak compared to the rest of the United States. The U.S. has seen the largest outbreak activity of measles in at least a decade, maybe even 2 decades in some areas, usually affecting unimmunized communities. So we have today a guest, Mindy Bundy, who's been with us a couple of times. Mindy is our nursing director, and she is over the clinical operations at the Southwest Utah Public Health Department. I guess to begin with, Mindy, how long have you been with us now?
Going on 19 years.
Okay, so 19 years. That's even longer than me.
Oh.
Now, I have to ask this because I don't remember any. We haven't really seen any measles cases at all in the time. Do you know if we've had any positive cases?
No, I have not seen it until now.
So almost 20 years, and we haven't really seen a single positive measles case in our 5-county district. I think there might have been a couple in Utah. There's always a few in the United States. Typically, they're associated with international travel, where people will go somewhere where measles is still pretty active. They're unimmunized, so they pick it up, bring it back to the States, and then it can spread in unimmunized communities. Mindy's been around for a while. You've probably given thousands of shots of all different kinds of vaccines to protect against these, what we used to call childhood diseases, even though anyone can get sick if they're unimmunized, right?
Right, yeah.
It's interesting to note that along with our measles outbreak, the first press release that we put out a couple of months ago alerting our residents, we also included unusually high numbers of whooping cough or pertussis. And that's another vaccine-preventable disease. Last year, we had 17 cases of whooping cough in our district. This year, we've had over 30, and that's year to date. And so it sounds like our whooping cough activity has at least doubled. And again, that appears to be in unvaccinated individuals. And whereas the measles vaccine is considered mostly a lifetime vaccine once you get the 2 doses, whooping cough, which is also in a combined vaccine that includes tetanus and diphtheria, if I'm right.
That's right.
That can sometimes require a booster. What's the current recommendations for pertussis shots for people?
So right now, children, it's part of the early childhood vaccination series in the DTAP. And that is licensed for younger children. They typically get about 5 doses before kindergarten. And then once they hit 7th grade, they're supposed to get a booster of Tdap, which also contains the whooping cough in it. The issue with that is that the DTaP is only licensed for younger children. So if you don't get those doses when the child is young, you cannot get them as you get older. Does that make sense? So that is one issue. Also, all pregnant women are supposed to get a Tdap during pregnancy to pass some of those antibodies to their unborn baby. And it doesn't matter how long apart those pregnancies are, it's with every pregnancy. And then any adult should have a dose of Tdap as well. So we assess for that when everyone comes into the health department. So say a new dad, he should get a Tdap to protect his young infant.
Say there's an adult who, there's not a newborn in the family, they're not even a grandparent, maybe with a new grandkid. If it's been so many years, is a booster recommended?
Yes, they should stay current on their tetanus shots, which is typically every 10 years. If you get injured, you should get it a little bit early, and we'll assess that, or the doctor will assess that when you go in. So commonly, if we see someone, say they're leaving the country and their Tdap or their tetanus shot is 6 years old, we'll recommend a booster. because we're not really sure access to vaccines in other countries. Also, adults, we look at that when they come in for any shot, pneumonia, flu, whatever it may be. We assess and let them know, hey, you're due for your tetanus. You should be getting a Tdap.
So tetanus around every 10 years, and that's included in that 3 vaccine.
Cough, yeah.
So you'll also get boosted against whooping cough and diphtheria.
Yeah.
Okay.
Yes, the licensure for a Tdap is a couple of doses separated by several years.
Okay.
Yeah.
So that's good to know. Some some vaccines, like measles vaccine, are lifetime. Others, you do need a booster, and then how soon or later that is depends on your situation. Are you pregnant? Are you going somewhere internationally? How long's it been since the last one? If anyone needs to know those type of things, talk to your healthcare provider or contact us at the health department. Your vaccine record that most people have, sometimes a hard copy of, should show those. Let's say there's a person that can't find their vaccine record. They're like, I'm not sure what my vaccine record is. Is that kept on a database somewhere?
Utah does have an immunization registry, and you can access it through an app called Docket. So if you download Docket, as long as the provider entered those vaccines into the registry, you should be able to find them. The issue is it's not required to do so. There may be some places that you get shots where they're not entering it. Public health is required to do so, so we always make sure they are in there.
As far as other healthcare providers, they may or may not enter them in.
Right.
Okay. And we'll talk a little bit later about older people and measles vaccines or boosters or questions they might have. But the topic of the day, like it has been for a few weeks now, is the current measles outbreak that we have here in southwestern Utah. It's estimated that for every child that gets measles, young kids, there's about 20% of them that will need medical attention or hospitalization. And so it's not just like a little rash or the chicken pox. Measles can be a little bit more serious. Our understanding is that it's truly airborne, very contagious, meaning that, Mindy, if you had measles right now and got up and left the room, I would get it if I was unimmunized. Anyone else walking through the room in the next 2 hours would also inhale measles virus and if they're unimmunized, get the disease. So extremely contagious. The good news is the vaccine, which has been around for decades, is very effective. The first shot is usually given around, 1 year of age?
Yeah, 1 year old. And then the second dose before they enter kindergarten, usually around 4 to 6 years old.
And tell us the effectiveness of those shots percentage-wise.
So the first dose is about 93% effective. And then if you take that second dose, it bumps it up to 97%. So it's very highly effective. And we are most concerned with measles and the complications in younger kids. So infants and children under age 5 can develop complications, and commonly some of those are ear infections or diarrhea, but you were mentioning more concerning complications. 1 in 5 can end up hospitalized. 1 in about every 20 develop pneumonia, which is the most common cause of death from complications of the measles. Children can also get encephalitis. This can happen to adults too, but encephalitis, which is swelling of the brain, and that can lead to permanent neurological problems. They can have seizures from the high fever. They can become deaf. Also, a very concerning complication called subacute sclerosing panencephalitis, which is another very uncommon, rare complication from the measles that usually results in death, and it can occur years after you've had the measles, up to 10 years later, you may develop something like this.
So there could be chronic or delayed effects from getting the actual disease. Now, there are some folks that say, hey, let immunity do what it's supposed to do naturally. It's better that I get the disease and my body builds up immunity. I mean, we do attain a lot of immunity from being sick from different viruses as we grow up and exposed to different pathogens, and our bodies are pretty good at that immune response. But what would you tell someone that said, I'd rather get immunity from having the disease and the vaccine? What are some of the risks?
Right. So you often hear providers say risk benefit. Does the risk outweigh the benefit? So is the risk of vaccine more, or is the risk of measles more? And you spouted off a few statistics, right? So 1 to up to 3 in 1,000 kids could die from the measles. And complications from the measles vaccine is 1 in 1,000,000. So there is far less risk from the vaccine than from measles.
Yeah, so just overall numbers, it's less risky to get the vaccine.
Right.
Plus, the most common side effects, I think, from the vaccine, and some people don't really have any side effects, are just a little bit of pain and swelling, maybe burning at the injection site, maybe feeling a little under the weather for a couple of days. Is that typical for a measles vaccine?
It is, yes. and it goes away quickly within 24 hours. Usually I say, maybe by tonight you may start feeling some of those symptoms as your body starts creating the antibodies. You may be tired tomorrow if you don't feel like getting up. You're a little more fatigued. You might have some body aches. You could have a little low-grade temperature. But that means it's working and it should go away quickly.
Correct me if I'm wrong here. A lot of vaccines are different from each other. Not all vaccines are the same. There are some vaccinations that once you get vaccinated, you may still get infected by that disease, but it will lower the severity of the disease, maybe keep you out of the hospital. COVID-19, I think, was categorized as a vaccine like that. But my understanding is with the measles vaccine, it protects you, but it also makes it so you don't get it and pass it on. Is that?
Yeah, we are doing a lot of, we were talking yesterday, or not yesterday, but the other day about measles prophylaxis. So some people that are exposed to measles that haven't been previously vaccinated, they could come in and get a dose of the measles, and it's about 90% effective from keeping them from developing the measles as long as they get it within that 72-hour window. And if they do get the measles, it's likely that it'll be less severe because they've had that vaccine. And there are other diseases that we do that for, like hepatitis A. If you hurry and get in and get the vaccination, we're hoping to either prevent the disease or lessen the symptoms of the disease.
Same for rabies, in fact, right? The rabies vaccine, which most of us get our dogs vaccinated against rabies, but it's not recommended for humans unless you're maybe working with bats as a profession or a wildlife person, or you think you've been exposed to a bat. And
right.
I think rabies is very rare in the United States. The rest of the world, rabid dogs are a big problem because the dogs aren't vaccinated. But if a human gets rabies, it's almost 100% fatal. But that's one of those situations where if a bat bit me and it turns out it's rabid, I have a window of time to hurry up and get the vaccine, and that could save my life. And with these other diseases you're talking about, like it was like hepatitis B, did you say? Hepatitis A, or measles. Even if you weren't vaccinated, if you were exposed, you have a little window there that you can hurry up and get at least one dose of the vaccine, and that can protect you or really knock down the severity of the disease.
Yeah, and with rabies, even though you may get vaccine to prophylactically to prevent you getting rabies, if you're exposed to the rabies, you still have to come in and get more doses of vaccine.
Okay.
Yeah, so you still need to come in. So I just wanted to make sure people knew that.
So with the rabies vaccine, it's not just one shot, it's a series to complete to totally protect you.
Yes, and then if you're exposed, you still come in again. It's just less shots, okay? And then you don't have to get the rig, is what they call it, immunoglobulin against the rabies.
Yeah.
A little less shots if you have had it to prevent the rabies. And we don't recommend that for everyone. It's just like, people that work with animals, veterinarians, maybe individuals that work in the backcountry that could come across, rabid animals back in the woods, things like that. Like Forest Service workers may be vaccinated, those kind of individuals.
Now you mentioned immunoglobulin. Did I say that right? That immune boosting treatment that gives you kind of a period of time that really ups your immunity after you're exposed to a disease.
It's a little shot of the antibodies that your body would create from either exposure or from the vaccine. So they give you that.
Okay.
In addition to the shots for like rabies, hepatitis. And that is actually what they would give a pregnant woman if they were exposed to the measles. They would give her IV, IG, because she cannot have the measles vaccine, so they would give her that.
Now, speaking of pregnant women and measles, if that woman was vaccinated in her life before she got pregnant, she's got that immunity. She actually passes on some of that immunity to her newborn.
So that is the reason why you don't give children MMR and varicella before the first birthday, because mother's antibodies might interfere with that. However, there are circumstances where an infant could get an early dose of measles, and that's on a case-by-case basis based on risk.
Okay.
For example, if a child were traveling somewhere where there's a current measles outbreak, we would recommend they consult with their provider to see if it would be appropriate for them to get an early dose of measles, which could be given between 6 months through 11 months of age. However, that still doesn't count towards their 2 doses. They still need to get the other 2 doses at the regular schedule to be protected.
These are different tools that we reduce risk. None of them are 100%. Some of them are pretty effective. Going back to the pregnancy and measles, pregnancy can be pretty rough on a pregnant mom, that she's vulnerable if she gets measles or another type of disease. When would a pregnant woman get that IV immunoglobulin?
It would be within 6 days of exposure, so it's fairly quickly. And we would recommend that if they aren't vaccinated and they want to become pregnant, that they would get the vaccine at least a month before becoming pregnant. Women that get the measles, they can have miscarriages, stillbirths, preterm labor, low birth weight babies. They can even pass the measles on to their baby, as known as congenital measles. And then pregnant women have weaker immune system. They could be susceptible to the complications from measles, such as pneumonia.
So that's interesting. We talked about pregnant women and measles, and it's another reason that young moms out there might want to consider, if they're not vaccinated, to protect you and that newborn, especially right now where we consider community spread measles occurring in our 5-county district, meaning it's not just in one little town, but we've had exposure sites that are up on the state's website in Hurricane, St. George, Hilldale, Cedar City, Beaver. Towns have had locations where someone went through that area with active measles. And so we put out the alert that if you were in those facilities during those dates and times, that you would want to monitor for symptoms. Certainly consider getting vaccinated if you haven't already. And that brings me to the next point. What does the measles look like? So let's say you don't have immunity, you've been exposed to measles. What kind of symptoms are going to show up?
Symptoms usually begin about 10 to 12 days after you're exposed. However, it can range from a week to 21 days, but typically it's 10 to 12 days. Usually starts with a high fever and then watery red eyes. You can have a runny nose, a dry cough. Another telltale sign of measles is about 50 to 70% of people develop what's called Koplik spots, or these white spots in their mouth. And then from there, a couple days later, starts the measles rash. And that rash usually starts on the face and then spreads down the body. People can sometimes spike a high temperature. We're talking 103, 104 temperature, fairly high temperature when the rash comes about. And they're contagious 4 days before the rash starts and about 4 days after. So you could be exposing people when you really are just starting to feel unwell.
I think that's why it's likely that even though we have officially 43 cases in our district, there could be scores or maybe even hundreds of actual measles cases of people who maybe didn't have the rash, or they recovered at home, or they were untested or unreported. It's an interesting time. Again, you and I have never seen actual measles until now here in our district. Now we hope there are early signs that we're peaking a little bit. We've been holding steady at that 43 cases. Our epidemiologists tell me that they've only got a couple suspect cases they're investigating, so it would be nice to say, wouldn't that be something if this peaked and died down? It's probably too early to say.
Yeah.
We don't want to declare it over and have it spike again. Other states have had a really rough time. West Texas had, I think, around 800 cases of measles, 100 hospitalizations, 2 kids passed away from that outbreak, and we hope that we've kind of hit the ceiling. That certainly would be awesome, because the more cases you have, the more it spreads, the more likely it is you'll find a vulnerable kid where they have a more severe reaction to the disease. So you mentioned the symptoms. If a person feels like, hey, me or my kid, I think this could be measles. This is a weird rash. I've never seen this before. What should they do?
They should go be seen, but they need to call before they go into the office, because I think most offices probably have a plan, or they may have a separate room where they can take you to isolate you from other patients because of how contagious it is. So you talked about how it stays in the room for 2 hours at least after the individual has been in that room. And so my understanding is that IHC has a plan, and so they do just request, please call before you come so they can prepare, and they'll give you instructions on what to do.
And at that point, you'll be advised by your healthcare providers and also the health department as far as how to isolate and quarantine and protect yourself and others.
The measles is reportable to public health. If a provider diagnoses the measles, it has to be confirmed, a confirmed case, they will notify us, and then that's when we start our disease investigation and try to make all our efforts to try to prevent the further spread of the disease within our community.
And when you say reportable, that means there's been a positive test, and they're legally required actually to tell us, hey, we got a case of measles here. The state adds that to the dashboard, where right now we light up as having really the only measles in Utah right now. So we talked about immunizations for kids with a regular schedule at 1 year old and around 4 or 5 as they go into school. Utah has a rule requiring kids to be up to date on their vaccines before they go into kindergarten. There's another threshold in 7th grade. In Utah, a parent can exempt their child from vaccines if they sign a form. They don't have to have any other reason other than I would rather my child not. That's certainly a parent's right. But the more kids that are exempted and unimmunized, we have a younger generation of unimmunized kids this thing could spread a lot easier. So my understanding is that in a community, it takes about 95% of people to be vaccinated to keep measles from taking hold. I think our vaccine rate for kids going into kindergarten for Washington County is down to 78%. So we're dipping below that safety line. Iron County is 85%. And for some reason, Beaver County is 97%. They've got it made. They're doing above average there on protecting their community. And so we do track those kind of numbers. Our hope is that we can convince and persuade parents to take a look at the importance of vaccines. It's a public health invention that in many ways has been miraculous. Some of the first vaccines that fought polio and smallpox have saved thousands, if not millions, of lives throughout history. And so our hope is that parents will take a look at that. You can hear a lot of scary things on the internet. I know before I worked for the health department, I thought, am I rolling the dice every time I take my kids in to get vaccinated? But you provide a great service. And so if anyone out there wants to get their shots through us at the health department, we say get them anywhere. But if you want to come to us, there's not a copay for the visit. It's just, and usually your insurance covers the vaccine, right?
Mm-hmm. Yeah, it does. I usually tell parents when their child cries, that's normal, right?
Yeah.
I'm like, they shouldn't like shots. It's okay, right? So if they're crying and they're not wanting to do it, that's okay. I understand. And I also can sympathize with the parents. Like I am choosing to make you cry, right?
Yeah.
So I always try to comfort the mom and just let her know, you're doing the right thing. They're going to be okay.
Okay. Well, and our nurses are great. You can go to our website at swuhealth.gov under immunizations to get information to make an appointment and learn more about the importance of immunizations. Thanks for being here, Mindy.